we will look into ECG machines, which are also known as electrocardiogram or electrocardiograph machines. Let's look at where it all began. In 1856, Rudolf Albert von Kolliker and Heinrich Müller were the first to discover that the heart generated electricity. 68 years later, the Nobel Prize was awarded to Wilhelm Einthoven, the Dutch investigator who transformed this curious physiologic phenomenon into an indispensable clinical recording. With the help of physicists and mathematicians at Leiden, Einthoven studied the spread of action potentials through tissues, introduced the three standard limb leads, and formulated the concept of the equilateral triangle by mathematically relating the three leads, lead 1, lead 2, and lead 3. So what does Einthoven triangle say? Einthoven's triangle is an imaginary formation of the three limb leads in a triangle used in electrocardiography. Formed by the two shoulders and the pubis, the shape forms an inverted equilateral triangle with the heart at the center. It is named after Wilhelm Einthoven, who theorized its existence. Einthoven used 3 measuring points by immersing the hands and feet in pails of salt water as the contacts for his string galvanometer, the first practical ECG machine. Let's learn how 12-lead ECG is acquired. A 12-lead electrocardiogram, or ECG, is a standard lead system used in clinical practice. A standard 12-lead ECG was designed to show the frontal components of a 3-dimensional electric vector in 6 limb leads and the horizontal components in 6 precordial leads. In the frontal plane leads 1, 2, AVR, AVL, AVF, the vectorial components of the frontal plane in 1, 2, and 3 are mathematically described as second lead as a combination of first and third lead. Augmented leads, AVR, AVL, and AVF can also be derived from leads 1, 2, and 3. Therefore, if 2 among leads 1, 2, and 3 can be obtained, we can reconstruct 6 frontal plane ECGs. Precordial leads, V1 through V6 attachment sites, are located anteriorly, covering only half of the chest for the convenience of the patient. For the standard 12-lead ECG to be obtained, 10 electrodes are usually attached. However, attaching this large number of electrodes is not suitable for monitoring purposes. Let's look into 16 and 18-lead ECG machines. The Philips machines use DXL ECG algorithms, which go beyond traditional 12-lead interpretation of the resting ECG. It also provides for incremental diagnostic capabilities not associated with analysis programs of the past 16-lead integrated analysis to take advantage of optional right chest and back electrodes to provide extended interpretations for adult chest pain. While the limb leads and chest leads comprise the standard 12-lead ECG, it has long been recognized that additional electrodes can provide information that is poorly or not at all seen on the traditional 12-lead ECG. In addition to the standard limb and chest leads, the DXL algorithm can incorporate any 4 of 6 additional leads from the following: right chest leads, V3R, V4R, V5R, posterior leads, V7, V8, and V9. Whereas Nihon Kohden synthesized 18-lead ECG uses the 12-lead ECG waveforms to mathematically derive the waveforms of the right chest leads, V3R, V4R, V5R, and back leads, V7, V8, V9. The measurement procedure is the same as the standard 12-lead ECG, but more information can be obtained. 18-lead synthesized ECG is expected to be useful in detecting right side and posterior myocardial infarction. What are the ECG filters used in ECG machines? Let's begin with the low-pass filter in ECG machines. A low-pass filter is often found in electronic circuits and works by reducing high-frequency components. The most common form of a hardware low-pass filter is a simple series resistor capacitor. At low frequencies, the capacitor is high impedance relative to the resistor. But as the frequency increases, the capacitor impedance drops and output falls. We see that around the frequency of interest, the cutoff is actually pretty slow. For example, for a 40 Hz filter, at 20 Hz there will still be more than 10% reduction, and at 100 Hz, still 37% of the signal is getting through. When testing an ECG's filter response and other characteristics, it is common to see effects due to filters above and below the cutoff frequencies. The second is the high-pass filter in ECG machines. High-pass filters are obviously the opposite of a low-pass filter. In hardware, a single-pole filter can be made out of a capacitor in series with a resistor. The corner frequency is the same, and the frequency response is a mirror image, a vertical flip, of the low-pass filter. The terminology associated with ECG high-pass filters can be confusing. While the filter is correctly termed a high-pass filter, it affects the low-frequency response, around the 0.05 Hz to 1 Hz region. So it is easy to get mixed up between high and low. The main intention of a high-pass filter in ECG work is to remove the DC offset, which in turn is largely caused by the electrode-gel-body interface. Unstable voltages of up to 300 meters VDC can be produced. In diagnostic work, the patient can be asked to stay still so as to reduce these effects, allowing the filter corner to be reduced down to 0.05 Hz. The third filter in an ECG machine is the notch filter or main AC filter. Notch filters combine both high and low pass filters to create a small region of frequencies to be removed. For ECGs, the main target is to remove 50 or 60 Hz of noise. Because main noise falls in the region of interest, especially for diagnostic ECGs, the setting of an AC filter is usually optional. ECG equipment already contains some ability to reject main's noise even without a filter. See the right leg drive. So depending on the amount of AC noise in the environment, an AC filter may not be required. A good check of your ECG testing location is to compare the signals with and without the AC filter on. Some systems automatically detect the main's frequency, others are set by the user or service personnel, while others use a single notch filter covering both 50 and 60 Hz. What is rhythm in ECG machines? Rhythm refers to the type of heartbeat. Normally, the heart beats in a sinus rhythm with each electrical impulse generated by the SA node, resulting in a ventricular contraction or heartbeat. There are a variety of abnormal electrical rhythms, some are normal variants, and some are potentially dangerous. Some electrical rhythms do not generate a heartbeat and are the cause of sudden death. Rhythm can be recorded for specific time like 1 to 4 minutes for analyzing PCV. Let's look into the types of ECG machines. First is cardiopulmonary exercise test, or CPET. A cardiopulmonary exercise test is an evaluation of the cardiopulmonary system. This test is used to detect any cardiac or pulmonary diseases. Second type of ECG machine is a stress test, also called treadmill test or exercise EKG. This is given while a patient walks on a treadmill or pedals a stationary bicycle to monitor the heart during stress exercise. Breathing and blood pressure rates are also monitored. A stress test may be used to detect coronary artery disease or to determine safe levels of exercise following a heart attack or heart surgery. The third type of ECG monitor is the Holter monitor. The Holter monitor is a type of electrocardiogram used to monitor the ECG tracing continuously for a period of 24 hours or longer. Electrodes, small plastic patches, are placed at certain locations on the chest, arms, and legs. When the electrodes are connected to an ECG machine by lead wires, the electrical activity of the heart is measured, interpreted, and printed out for the physician's information and further interpretation. The fourth type of ECG machines is a resting 12-lead EKG. This type of electrocardiogram is the standard test for measuring your heart's electrical function. Performed while you are lying still, this EKG records your heart's electrical activity from 12 electrodes, sticky patches, on your chest, arms, and legs at the same time. A resting 12-lead EKG can be part of a routine checkup to screen for heart conditions before any signs or symptoms develop. The fifth type of ECG machine is signal-averaged electrocardiogram. A signal-averaged electrocardiogram is a more detailed type of electrocardiogram, ECG or EKG. During this procedure, multiple ECG tracings are obtained over a period of approximately 20 minutes in order to capture abnormal heartbeats which may occur only intermittently. There are many types of ECG monitoring devices available in the market today, like wireless ECG machines, portable ECG machines, wearable ECG monitors, ECG monitoring watches, and many more. This was a simplified information video on ECG machines. We will look into ECG graph paper, QRS complex, and electrical activity of the heart in the next video. I hope you liked the information in this video. If you did enjoy it, please give us a thumbs up and subscribe down below. I will see you guys in the next video.